Greetings all. My name is Jocelyn Keaton, and I am the GNSA University Liaison for The Ohio State University here at the College of Nursing. And today I have Dr. Karen Rose with me, who is the Dean of the College of Nursing. Welcome, Dr. Rose. Thank you so much for being here today.
Absolutely. Thank you for having me.
So this is just an awesome opportunity for us to just kind of go over some questions and kind of get into your thoughts and your brain about being a emerging nursing leader in our nursing workforce in healthcare.
Super.
So first question I want to ask you is, go ahead and give the community, what's your title and your role here as the Dean of the College of Nursing?
Sure. So the title is the Dean of the College of Nursing. My rank is a professor, and my role really is to have administrative oversight of all that we do, from academic programs to research to the service that we do in the community, and really how are we stewarding all of the resources that we have here at Ohio State for the betterment of healthcare for others.
Your job sounds very serious and very, very important and stressful. Can it be stressful for you at times?
It can be stressful like any role because you take it seriously.
Right.
And I think the stakes are high, certainly when we're talking about educating the next generation of nurses and healthcare and other healthcare leaders. Serious business. Right. So I try to take myself kind of lightly, but the job, I'm pretty serious about it.
Awesome. Well, we appreciate you being here and appreciate the work that you're doing here for us at the College of Nursing. So describe to me your career. What was your trajectory to get to this point, being a dean?
Okay, so that's great. So it wasn't on my radar per se when I started nursing many years ago. Like all nurses, you wanted to take care of people. That's what brought you, into this role. You know that. So I really focused the first probably half of my career on patient care. And so really wanting to be the best patient care advocate and clinician I could be. And along the way, that gets you into some staff development ideas. And I thought, this is kind of cool. I really like teaching people and helping other people learn and teaching myself as well. That led me then back through some of my community engagement, back into wanting to get my PhD, because I understood then that I could have a potentially larger impact from the work that I do. So went back, I received a PhD in nursing, and then really from there started a trajectory in academics, led a baccalaureate program, led a PhD program, did some more administrative work, et cetera, got my program research funded, and then really felt like, okay, this is fun, and this is exciting work, and I love working with people and influencing people and events, and so the dean opportunity really was kind of a natural outgrowth of that. Awesome.
So I'd like to ask you a follow-up question to that. So you have a PhD, right? And
yes.
You are a PhD prepared nurse.
Yes.
Do you think that a DNP prepared nurse will be able to fit into a dean role as well?
I think many DNP nurses are deans.
Nice.
And so I think the answer is clear that yes. I think that it's context specific in terms of what the organization's looking for. It's all about fit, and do the skills fit what they're looking for and where their aspirations are. And so I think for many schools the answer is sure, a DNP. We've got DNPs leading large schools. And more traditionally, PhDs, because it's the research degree. DNP is a practice degree, right? And a PhD is a research degree. So in many ways, if the notion's always been that if you're leading researchers, and if part of your role is really leading a research enterprise as well, the PhD, I would say, has been the conventional. And the world's changing. So, yeah.
Thank you, Dean Rose. That's great. I love that answer. It also gives us DNPs hope.
Oh, of course.
That we can be in a impactful role.
Absolutely.
In a dean category or a dean specifics. So how would you describe your leadership in nursing healthcare currently?
So I've always talked about myself in the context of being a servant leader. And what I mean by that is I really do see value in serving others, helping to uplift others. So that's how I would describe it. I think that doing the different tests that you find out more about your leadership style or your personality or whatever that is, I tend to be a collaborator. I tend to be a connector. And I think those really are the descriptions of my leadership style, probably better than anything else.
That is wonderful. Great attributes to have. So what specific issues in nursing and healthcare do you feel like your work really addresses? I know we talked about servant leadership and we talked about helping people. Here at the College of Nursing, as the dean, how do you see your role fitting into how are we impacting others, including our students?
So that's a great question. I think the first and foremost, I've spoken to this about really trying to educate the next generation of nurses, and we have other degrees here, so other healthcare leaders as well. So I think that's a big part of the work that I do. Certainly there's a workforce issue, not only in Columbus and in the state of Ohio, but certainly nationally and internationally. There's a shortage of nurses. And so how are we addressing that? So one way we're doing that is looking at additional partnerships with the medical center and other entities and other industries, growing some of our enrollment in some of the programs that we have. The traditional undergraduate is one of those. Understanding too, we've recently brought back in an accelerated baccalaureate program, knowing that some people choose their first career and for whatever reason say, that's not me, but what I really want to be is a nurse. How do I become a nurse? So opening up that pipeline for people as well. So I'd say that, the impact that I'm having is trying to open up pipelines for people to become nurses and making sure that the students we educate get the very best opportunity and experience here, certainly to hone their skills, not only psychomotor skills, but also their critical thinking skills, their connection skills, their team building skills as well, because that's all a part of what it takes right now to be a member of the healthcare team.
So I'd like to ask you a follow-up question to that. That is excellent in terms of how we're trying to build our profession and support our profession. In your best estimated educated guess or answer, because I know this is $1 million question. If we could answer it, we'd all be rich. What do you think, or do you think there are any gaps in education in the workforce? And how can we kind of glue that together? And I say that because as a clinical educator here with the College of Nursing, a lot of my students talk to me about, well, we learn this in the classroom, but when they get to the real world, as they so to speak, they see different things and they have to learn a different way. So do you think that there is a gap between how we're educating and then how we are actually, moving people into practice?
Yeah. So I think the short answer is yes, there's a gap. And I'd say to you two things that, we're trying to use, for example, with some of our major partners, the medical center, OSUMC is one of them certainly, similar equipment, in our simulation lab, so that there's some transfer of knowledge and that there's some familiarity. Having said that too, that regardless of the equipment, what we're trying to teach our nursing students is the thought process, right? So regardless of equipment A or B, what you need to know is, the correct dose. Some of the mechanics may be different, but you need to know the understanding of what in the example of a medication, what's the correct dose? How do you get it to that dose? What are the other checks and balances you need to have in the system, et cetera, et cetera. So even where we don't align, A to A exactly in terms of a piece of equipment, where we do align is with the critical thinking. And that's sometimes people want something that's familiar, right? So if we can shorten that gap to get them familiar so that their orientation maybe could be lessened and their ability to be confident clinicians, they can move on to something else sooner, that we want to do that. And I'd say that I'm not going to chase every new piece of equipment. What I'm going to chase, though, is people's ability to think and what's behind the piece of equipment that they need to understand. Does that make sense?
I love that. I love
following?
that.
Okay.
That
right.
is awesome. And that
Sure.
helps us as, clinical instructors or instructors in the classroom. That helps us kind of frame how we're getting the information out to the students. So I love that. Absolutely love that. What will be better in nursing and healthcare because of your leadership?
That's a great question. What I'd like to think is that the partnership with our providers, I want to close that gap more, because clinicians, say on the other side of the table, the clinicians at the bedside, they have so much valuable information, wealth of knowledge that isn't always transferred to us on this side of the table. And so really trying to look at ways that we're working more closely together, and to really educate each other, educate the next generation of nurses, and to provide, I think, opportunities. There's certainly a big notion of burnout and mental health issues, and people wanting to, both on our side, certainly students, what they're experiencing, and nurses. And can we be a kind of an off-ramp somehow? Can we build more of a circuitous, you don't have to leave nursing. Come back and let us help you in this way. Can we develop you in another way? So I hope my impact will be that fewer of our nursing students, or more of our nursing students, stay in nursing and really stay engaged in the work that they came here to do from the beginning.
That is great. I like the way you said that, how if you don't have to leave nursing, right?
No.
We all struggle.
Right, right.
From whatever point we're at, but you don't have to leave. Come back, find something else to do. So I really like that. I can resonate with that. Is there anything, I do have one question. This kind of off. Why OSU? Why The Ohio State University? If somebody's watching this and they're like, I don't know, why would you say, come here?
Yeah, okay, that's great. I mean, my first question would be, why not? Certainly, but I'd say too that, what goes on at a state level, what happens in Ohio, is happening nationally. So you don't need to be on either coast to see, it's happening here in Ohio. The good, the bad, the ugly of healthcare, is happening here. We've got rural, we've got Appalachian, we have big cities, etc. So whatever you're looking for in healthcare, or whatever the challenge is, the opportunity is here in Ohio. I'd say too, specifically at Ohio State, we do have the advantage of being on the same campus, right, a stone's throw away from the other colleges here, from the other health sciences colleges. And while geography certainly matters, I think it's what we do with that. So more in the work that we're doing in terms of interprofessional education, the work that we're doing at the bedside together, the work that our researchers are doing together. I think that's the value add. I'd say that's the secret sauce of Ohio State. And certainly because we're a land-grant university, I think that that's in the DNA, that this notion of collaboration and real-world impact is what we're about. So I would think that that there's something to resonate, I think, in all of what I just said with anyone.
Right. That's awesome. Now, I'm partial because I am a student here at Ohio State University. I've got my bachelor's degree from here, my master's degree, and then prayerfully in spring of 26, I'll have my doctorate, my DNP degree from Ohio State. So I would say I agree with you that why not come here? Because this is a great university, and we have great leadership here at Ohio State.
Agreed.
Well, Dean Rose, I just want to thank you.
Oh.
This has been such a great opportunity and such an honor for me to be able to interview you for the community abroad. I have one final thought for you. OH.
IO.
Go Buckeyes!